Hi everyone, I'm Rupakshi and I am working as local pod assistant here in Sydney from over 2 years. And today I'll be sharing my top 5 non-negotiable foot care tips for anyone with diabetes. Nerve damage and poor circulation can happen slowly. You're not even gonna know, especially if you have diabetes, because it's not like you are going to dentist and you're having the local anesthesia that you're gonna feel straight away, oh, you don't have feeling in this area. No, with diabetes it's really very slow process, and most of the people, they don't even realize that you don't have feeling. So this simple step can cause you severe problems, especially like losing the feelings in your feet and decrease in the blood supply, especially to your feet, because they are the farthest body apart in the body. Now there's 5 tips. Tip number 1, check your feet every single day. Now diabetes can numb the nerves in your feet or you might not feel, but also diabetes do affect your blood vessel in your eyes. So basically some people do have retinopathy, that their eyesight gets blurry. So I completely understand for them, those people, it'll be very hard for you to check your feet every day. But we got solution for every problem. What you can do is you can put your phone camera on and then you can move your foot up down, and then definitely you can see from close. If still you fail, you can't see clearly, you can send to one of your close family member if you have one. Yeah. Now for the people whose eyesights are good, it's good to check if you have any blister, if you have any cut, or if there is anything that's stuck in your shoes potentially, because your feet won't be able to communicate to your brain well. So these are the things as a podiatrist we would encourage you to check every day. If you get any cut, any small dry skin or anything like that, check for any sign of infection like redness, swelling, hot. Check the temperature. If you do see any of it, it's time to go to your doctor to get antibiotics, or you can visit your local podiatrist in your area. Now tip number 2 is always wash and dry your feet at the right way. Always use like not too hot, not too cold temperature. First test it with your elbow, not your foot, because your feet, remember, your feet can't feel. And always rub gently, as the most important thing, I as working in a podiatry clinic, I do see out of 10, 9 of the patient, they do have like maceration, which is called like sort of infection between their toes, because the thing is the toe sits like this when you wear shoes. So whatever, when you take shower, the water just gets stuck between your toes and never gets chance to dry. So it'll be good to always dry your feet before putting the socks on. You can dry it between the towel. If you can't reach, because people do lose flexibility as with the age, what you can do is you can buy a big scale and try to apply the gauze at the end of it. So you, while sitting on this comfy chair, and if your favorite comfy chair, you can just put between your toes. Also, never ever put cream between your toes. We always educate you to put cream on your feet, but never between the toes. Now the tip number 3 is never ever walk bare feet, because with age your body changes, your skin becomes fragile, like, because it's more like, imagine the condition of a car, you owned it for 80 years. So same with your body, like your body been supporting you from 80 years. So this age change comes from use of the body you do. Never walk barefoot. Always wear shoes or proper slipper. Pick shoes according to your right size. Always ask the store manager or any person who is working in store. Always buy a size bigger than your actual shoes, because so that way there is enough space for your toes to when you walk to help you in the move, so you're not going to rub on the outer soles. And the reason why most of the people, they don't even know their right size, and they buy the shoes bit tight, and their toenails get bit hardened because they keep on rubbing the sole, this portion of your shoes. So you can do things like these if you can do to improve your overall feet condition. Now the other thing is trimming nails safely. If you can't see it, there's no point to cut them. If you can see then still I'll advise you always to cut the nails straight. Most of the people, they never cut their nails straight, and they go into the corner. With age, nail do get hardened, so they can't fully properly cut the nail, and they end up with ingrowns. Ingrowns are painful, and they get quite painful, and they cause bit of swelling and sometimes potentially infection. And the tip number 5 is always see a specialist regularly. Even if your feet feels fine, minimum once a year for your diabetic assessment, just to make sure everything is okay, because we study 5 years in the university to actually study feet. So some people think, oh, everything is fine. It's good to always get confirmation. Thanks for watching my video, and let me know what you want me to make the next video about. Thank you. Enjoy your evening. Bye. Don't tell me what happened.